This is the first video on a series of videos on hepatitis and will be an introduction as well as discussing the causes. This video will discuss hepatitis in adults. Hepatitis refers to inflammation of the liver. The liver is the largest organ inside the body and lies to the right of the stomach. It has over 500 functions. There are many causes of hepatitis, including viruses, excessive alcohol, drugs, and too much fat within the liver. Hepatitis can be divided into acute hepatitis if it resolves within 6 months and chronic hepatitis if it persists for more than 6 months. The liver has many functions. The important ones are breakdown of carbohydrates, proteins and fat, production of proteins, production of clotting factors that prevent bleeding, production of bile, which is important for digestion of fat, excretion of bilirubin, which is a waste product of the breakdown of red blood cells. The liver helps to purify the blood by changing harmful toxins into harmless ones, activating or inactivating drugs, storage of energy in form of sugars and fats, storage of vitamins like A, D, E and K. Let us now discuss the symptoms of hepatitis. The majority of patients with acute and chronic hepatitis have no symptoms. However, hepatitis may cause symptoms, particularly if acute. These symptoms include fatigue or tiredness, loss of appetite. Sometimes there could be flu-like symptoms like fever, headache, abdominal pain or discomfort, yellowness of the skin and eyes, dark urine and pale colored stools, and if the hepatitis goes on for some time, there could be unexplained weight loss. There are many causes of hepatitis. One is viral hepatitis. There are 5 types of viruses that can commonly cause hepatitis. Hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. This is an illustration that shows you how each of these viruses that cause the hepatitis looks like. Let's first talk about viral hepatitis A. One gets hepatitis A usually by drinking contaminated water or eating contaminated food. It usually spreads from person to person via the fecal-oral route, meaning via fecal contamination of water and food. It only causes acute hepatitis and does not progress to chronic hepatitis. In the majority of patients, especially in the young, it is usually mild. It typically gets better without treatment. Liver failure and death are rare, except in elderly patients and those with pre-existing liver disease. There is a vaccine available for hepatitis A. Let's now talk about hepatitis B. I'll be talking in greater detail about chronic hepatitis B in another video. One gets hepatitis B through different means. It can be spread through exposure to blood and blood products, from the mother to the newborn, through heterosexual activity, through tattoos and body piercing in unhygienic places, among healthcare workers, for example, by accidental needle stick injury, rarely by sharing toothbrush, razors and nail clippers, and among homosexual couples. If newborns and infants are infected, over 90% will progress to become chronic hepatitis B. However, in adults, only about 5 to 10% progresses to chronic hepatitis B. Hence, age is an important factor as to whether acute hepatitis B progresses to become chronic. Hepatitis B is not spread through sneezing, coughing, hugging, breastfeeding. Although the virus can be found in saliva, it is not believed to be spread through kissing or sharing utensils. There is a vaccine for hepatitis B. Hepatitis C is mainly spread through contact with blood or blood products, body fluids, through sexual intercourse, and injection drug use. So the mode of transmission of hepatitis C is fairly similar to hepatitis B. Today, the commonest method of transmission is through the injection drug use of recreational drugs like heroin, amphetamine, cocaine, as is shown in this picture. Unlike hepatitis B, transmission from mother to baby during childbirth is uncommon. Over 80% of patients with acute hepatitis C will progress to chronic hepatitis C. There is no vaccine for hepatitis C. Another type of viral hepatitis is hepatitis D. It is rare and can only infect people who have hepatitis B. There is no specific vaccine for hepatitis D, but the hepatitis B vaccine will protect. Hepatitis E is less common and transmission is similar to hepatitis A. It mainly occurs in countries with poor sanitation and water supply. The virus has been associated with the consumption of raw or uncooked pork meat, wild boar meat, venison, and shellfish. In the majority of patients, hepatitis E is mild, except in pregnant women, where it can be dangerous. There is a vaccine available, but it is only licensed in China. Another common cause of chronic hepatitis is non-alcoholic fatty liver disease, where excess fat is deposited in liver cells, causing liver inflammation. This is shown in this image, where a piece of tissue has been taken from the liver and studied under the microscope. You can see fat droplets within the liver cells. This condition can progress to scarring of the liver or fibrosis and hardening of the liver or cirrhosis. Non-alcoholic fatty liver disease is today the commonest cause of liver disease in the developed world. Risk factors for fatty liver include obesity, diabetes mellitus, insulin resistance, and metabolic syndrome. There are a series of videos on non-alcoholic fatty liver disease, and if you are interested in it, you can see those videos. So far, we have discussed viral hepatitis A, B, C, D, and E, and non-alcoholic fatty liver disease. Another common cause of hepatitis is excessive consumption of alcohol. It causes both acute and chronic hepatitis, and there are a series of videos on this. Certain drugs can also cause hepatitis. These include an overdose of paracetamol, aspirin, and painkillers like non-steroidal anti-inflammatory drugs or NSAID, antibiotics like the combination of amoxicillin and clavulanic acid, which is very commonly used for chest infections, and medicines used to lower cholesterol like statins. Also, male hormones used by bodybuilders can also cause hepatitis. It is not uncommon for some toxins, herbal remedies, and dietary supplements to cause hepatitis. Another cause is autoimmune hepatitis. In autoimmune hepatitis, the body produces antibodies that mistake the liver for a harmful object and attack it. It usually occurs in women. It is not clear what causes autoimmune hepatitis. There are rare genetic conditions which can cause hepatitis. One is where there's an excess deposition of iron in the liver. This is a picture of liver tissue that is studied under the microscope. You can see deposits of iron within the liver cells. These bluish dots are iron deposits within the liver, and this can cause chronic hepatitis. Another genetic condition is excess copper deposition within the liver. Here you can see the orange areas within the liver tissue. These are areas where copper is deposited. It's another cause of chronic hepatitis. Both excess iron or copper deposition in the liver can cause liver damage. Genetic conditions are disorders that run in families and are transmitted via faulty genes. There are also many bacteria and parasites that can also cause hepatitis in adults, but I shall not discuss it here.